If you are scared of tearing, this is going to be a good live for you. It's going to be quick, but it's also going to be very informative, because when I ask people what their fear is, they'll say, I'm afraid of tearing. And there are ways to prevent that. There are ways that you can actually prepare to prevent tearing, but you have to know how ahead of time. And even if you do tear, it's usually not a big deal. Okay, so to give you background, obviously y'all know my first birth was an emergency C-section, so there was no tearing there. In my second birth experience, I did tear. I had a 2nd-degree tear, and it, was a little bit irritating in the first week, but then everything was fine. And I was on bed rest anyways, which all of you should be on bed rest in the immediate postpartum. So as long as you're not putting a ton of pressure on it, it's really not as big of a deal as it sounds like. But let's do the work now to prevent ourselves from even being in that situation, or doing the best thing that we can do to try to avoid tearing. So I'm going to tell you 5 different things that you can do starting now to help you prevent yourselves from tearing when you are in labor, because there's a lot of stuff that you can do. So if this is a fear of yours, hopefully this will be helpful. Hopefully you'll take this advice and apply it and do it now, or when you need to start doing it. So the first thing that you need to do is, when you're around 34 weeks, we need to start doing perineal massages. So for some of you, you're gonna be like, ooh, that's weird. I don't want to touch down there. I don't want my partner to touch down there. But when I tell you, if you do it, there has been a lot of research, and obviously moms who have done it, who have said it's very effective. So you can use 2 fingers or your thumbs, and what you're doing with a perineal massage is you are stretching and helping that elasticity of your skin be a little bit more flexible or elastic, I guess, if you want to call it that, during labor, so that when you're stretching, it's a lot easier. Your perineum has already been, familiar with stretching, and a lot of research has shown that doing those perineal massages starting at 34 weeks, you can do them around 3 times a week or more. You could do it daily if you want to, but you could pretty much get the same effect with 3 days a week. And you can do it, or your partner can do it, but those perineal massages will really help with preventing your cells from tearing. With perineal massages, there is a decrease in pushing time. So if you're not trying to push a long time, obviously if you watched my myth video about pushing, you'll know that we don't really have to push a long time if we wait for our body to push. But if you want to even try to reduce the amount of time pushing, perineal massages can help with the time in pushing, and it also can reduce the amount of pain in your vagina after birth or around your vagina, because you will be sore. Even if you don't tear, you might still be sore. You just pushed a whole baby out. So number 1 is perineal massages. Number 2 is seeing a pelvic floor therapist. More people are starting to understand and know what your pelvic floor even is and how that contributes into your birth experience. Seeing a pelvic floor therapist, even if it's once or twice, just to understand the state of your pelvic floor, is extremely helpful when it comes to tearing, because you don't necessarily know how strong or weak or overactive your pelvic floor is, because when you get pregnant, we're like, oh, how do we prevent tearing? Or how do we do this? How do we do that? And then you read a lot of things about Kegels. Well, Kegels aren't necessary for everyone, but if you don't understand the state of your pelvic floor, which for me, I didn't know the state of my pelvic floor in either one of my pregnancies. So it could have been helpful, because as somebody who works out a lot, I probably, if I would have gotten an exam, I might have been shown, and a lot of athletes do have overactive pelvic floors, meaning that doing Kegels is actually going to cause your pelvic floor to continue to be overactive, and it may prevent you in actually relaxing your pelvic floor when you need to, because you may not know how to. So seeing a pelvic floor therapist can actually help you understand, okay, do I need to do Kegels? Do I not need to do Kegels? Do I actually need to practice more relaxation techniques? What do I need to do? And so understanding, like I said, the state of your pelvic floor, even if you're just going and seeing one one appointment, seeing somebody for one appointment, that's really beneficial because you need to know where your pelvic floor is. Doing 100 Kegels a day, while you may feel like, oh yes, I can hold my pee in for like 15 seconds, that might actually hurt you in labor. So Kegels, use them sparingly. Every single person needs Kegels at a different level. I'm not a pelvic floor therapist, but look into that. Do some research on pelvic floor therapists in your area, or even try to see somebody virtually to kind of see what kind of things you can do to yourself to see how to know where your pelvic floor is. Now, the third thing is breathing. So if you want to reduce your risk of tearing, you need to know how to breathe during labor. If you don't know how to breathe during labor, you're actually going to be doing yourself a disservice, because when we actually get to that pushing stage, if we are doing too powerful of breaths, or we're putting too much pressure down there in our perineum, that can actually cause us to tear. But if you saw my video before about how to breathe a baby out instead of forcefully pushing a baby out, that actually helps your perineum slowly stretch around your baby so that your baby is not forcefully coming through and not allowing your body time to actually stretch around baby. That's why we talk so much about breathing your baby out and not forcefully pushing your baby out. Now, I'm very aware that if you are in certain birthing environments, they may tell you to close your mouth, stop making a noise, and hold your breath for 10 seconds. You have the opportunity to either do that or not do that. It is up to you. Whether somebody's telling you to do that or not, it's up to you how you breathe. I would highly recommend that you educate yourself before you get into labor so that you understand the differences between moo breaths and forceful pushing and what that does to your perineum and what that does just for your oxygen levels in general when you're pushing, and how that can actually cause more damage to your pelvic floor to hold your breath. But you have to do what feels best for you in that moment. Just understand that when it comes to tearing, if you learn the breathing methods and techniques to breathe your baby out with slow, deep breaths, and then when baby begins to crown, you start to do a different sort of breath. I have a whole video on this on my YouTube channel. Then it's going to help prevent your risk of tearing, again, because it's allowing your perineum to stretch slowly around your baby. Number 4 is your pushing position. If you are not in an optimal pushing position, meaning that this little thing right here called your pelvis, your outlet, which is where baby comes out. Remember, I just did a video about this best pushing positions on my Reels tab, so check that out. If we want to open this outlet up, right, the bottom, this is where baby comes out. We want to open up this outlet to make it as wide as possible for baby. You have to be in the right pushing position, because if we are on our hands and knees, you can do that. But if we are sitting on our backs with our knees wide, it's going to do this. And that is going to actually cause us to have less room for baby to move out. So if we're thinking about, okay, my baby's moving out of something that looks like this versus something that looks like this, well, baby has to do a lot more work to push through a smaller space, right? So naturally, there is an increased risk of tearing if you're not in a position that is actually opening up the outlet of your pelvis. And then the last thing is water. So hydrotherapy is extremely effective when it is when you're in labor, whether that be for comfort measures or for pushing. If you have the opportunity, I don't know if you're in a hospital, this may not be an option for you. If you are not in a hospital and you have access to a tub, that water can actually cause your tissues to relax. And as a result of that, it can actually help that whole pushing process by preventing so much of a more rough situation, right? Whereas if you have water or you have something moist supporting that pushing, and if you're in a hospital, this could also look like a warm washcloth that you're holding, maybe your nurse or your partner holding on your perineum, but holding a warm rag while you're pushing underneath your perineum, because that can also help prevent from tearing alongside of that breathing and helping baby come out slowly. But water can also help relax those tissues, which makes it easier for you to stretch. Even if you do all 5 of these things, there's still a chance that you could tear, maybe 1st or 2nd degree tear. These are all very common. They are not super scary. It is not going to cause you to have to have a ton of sutures. It might just be very minor and it'll heal very quickly. But I want you to know that it doesn't have to be scary. It doesn't have to be something that you walk into birth fearful of, because if you understand birth, when you walk into birth with a fear, most likely it is going to show up. And if it shows up in labor, you're going to get really tense. And if you get really tense in labor, it's really hard for your body to relax. And we know that we need to actually relax to progress through labor. So hopefully you'll continue to educate yourself. Hopefully you'll find resources, classes, things like that to take and go through, so that all of the things that you're nervous about, somebody from the professional standpoint of birth can actually help you overcome those fears. I hope that this was helpful. If you want to learn about all of this stuff in a very streamlined process, which is what I did not have the first time around, I wish I would have had just one organized place to learn, versus like Googling this and following this page and doing that and talking to this person and then trying to put it all together myself. My course is going to streamline all of that for you from an evidence-based perspective. And it will provide group coaching so you can ask questions. Now, you don't have to join our group virtual live sessions if you don't want to, but if you want to have, kind of support and questions and having somebody walk through the course with you in a very easy to follow for you and your partner way, that's going to be a really beneficial course for you to go through. One way or the other, continue to educate yourself. It doesn't have to be scary. You are capable. Your body is capable. And even if you tear, that's okay. It doesn't have to be the scary, crazy thing that people make it sound. Just make sure that you're doing the work to prepare your body ahead of time. So, love you all. Have a wonderful weekend, and I will see y'all next week for another live.